So we have a publicly funded addiction treatment system. And so what that means is that you are eligible for a treatment bed funded by the Ministry of Health and Long-Term Care in Ontario, provided that your assessment, which is standardized, you have to have an assessment done in a standardized so there's places that are funded by the same healthcare system to administer and perform. It's like going to get your clean energy test, right? There's certain places that you can go and get it. There's certain places that are funded to do this standardized assessment. And so if you've had the standardized assessment and it shows that you actually need to be in a live-in treatment center as part of your recovery plan, then you can access that treatment bed for free. So there's no cost to the individual. If you don't align with being entitled to that spot, then you may have to pay for it. Some people do pay for it because they want to avoid the wait time. So there's the burning issue in Ontario. Sitting here today, I'd like to tell you that we have private pay beds and we have publicly funded beds. We started with private pay beds because unions approached us. Part of the contract language in Ford and Chrysler and Unifor, like other places, CP Rail, we have a number of unions that we do business with. They cannot get paid. Their language in their contract says that an employee cannot collect their sick benefit unless they're actually in treatment. So they have to be under the care of a hospital or a physician, or that's part of the language. So they do recognize that addiction is a disease and that they need treatment. But until they're actually in a treatment bed, they can't collect money. So often they've been disciplined at work, so they've been taken off the job, and they have no support, no financial support, no entitlement to their insurance benefit until they enter a treatment center. And the wait time varies, but it's probably like a low of 66, and it's been as high as 104 days to get into our treatment centers. So people think that when they call up, they finally reach that point. I'm ready. I'm coming. It's like, it's going to be about 100 days before you come here. So unions said we need to have beds. We have to be able to have some place to put our members. We can't wait in line. So we created these beds to be available. And they've become a necessity because the government has had us in zero-based budgeting for the last 5 years. And what that means is that the amount that they give me to operate the publicly funded beds has not increased in 5 years. Based on the Consumer Price Index, which is the inflationary rate for Ontario on average, that represents 28% shrinkage in the amount of money that I have. For areas like food, which has gone up 104%, and utilities, which has gone up like 87%, where do I get that money from? I mean, you only have finite amount of resources, costs are going up, but when you're publicly funded, revenues are not. So you have two choices. You can deteriorate quality, constrain services, or you can find other revenue streams. And if you know the publicly funded addiction treatment system, people do fundraising, right? And when I came here, they did a walkathon and, we sell cookies, we do golf tournaments, but we've gotten away from all that because that's just distracts us. We're trying to make money doing things that we're not very good at, like golf tournaments and lotteries and bake sales and galas. What we do well is provide addiction treatment. And if we're the best at that and we're focused on that core business, then we have the opportunity through productive enterprise to create a revenue stream that will be way better than anything we could ever do by distracting ourselves to do these other things that we're not good at. So we created these private pay beds, and now we're dependent upon them to generate the revenue to cover the bottom line. So what I say is we have 24 beds at our men's treatment facility, and we have 16 beds at our women's. So when I start the year, April 1st, 2016, my fiscal year that goes to March 31st, 2017, based on the funding that I get from the government, I have a $530,000 hole to fill to operate. That's a lot of cookies. That's a lot of walkathons. That's a lot of golf tournaments. The fee-for-service beds are the ones that generate that revenue. So it started with unions and people paying a per diem. And what we found is that there's a lot of people that can't wait. and that have the resources to pay. The downside of that, and the part that we all struggle with sort of ethically, is we've created a system where those who have resources are able to access treatment ahead of those that don't. And that's what happens in the private system in the US. And that is a tough thing sometimes to swallow, because it's not right and it doesn't feel right. But it is a necessary evil, because if it weren't for those people that had the resources to create that revenue stream, we would have to compromise the quality or reduce the number of people who don't have the resources who could get treatment here. So I guess I'm saying that in the ends justify the means, and what's true, how we live with integrity as an organization and our values, is the kind of care that you get when you pay is not at all different. It's not any different from the kind of care that you get when you don't. I'm really held to a high accountability by the people that work here to ensure that is not happening. So you get in sooner because you are buying a bed that's not publicly funded, but you go to the same program, you adhere to the same expectations, and you are asked to leave for the exact same reasons as someone who didn't pay. So, but yeah, more and more, I think we're going to be moving towards a two-tier system of accessing all kinds of healthcare services in Ontario.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.